sitting in a chair to eat dinner. I got 15 minutes on anything that's other than sitting on a really soft couch that may take with me when I leave. But it gets very difficult. Sitting in a car, I can tell you where every pothole in the Flathead Valley is. I can tell you if a bad driver keeps hitting curbs. It's kind of a side joke, but to pull myself together, and I am not functional before the second dose of medication. The first one takes the pain off after laying there all night. Just have had one arm surgery where I've had to rewire my arm basically, and I've got another one on the 15th. I've got no feeling in my left hand. My fingers are numb. The palm tingles and my thumb tingles, but I really have no use of it. It won't hold up a cup of coffee. And trying to balance myself against anything, I can't rely on that. Because of the back injuries, I can't rely on my leg. So my entire left side is completely problematic as far as safety is concerned. I consider myself one of the lucky ones, which is the odd thing. So when I hear they talk about putting these heavy restrictions on opioids and that they're battling this opioid epidemic, I sit back and I listen to this. I says, do they realize what they're going to do to us? Those of us that wake up and we can't get our head off the pillow, we lay there with our head on the pillow, we can't move, come out of surgery after 4 hours in surgery, and instantaneously the pain hits from laying in one position for 4 hours. It's so bad that you start vomiting all over yourself. And another wonderful part of this is the continuous nausea, the continuous vomiting, not being able to get out of bed because the back hurts or you don't trust getting up and having to vomit on yourself. And I do want to do a shout out for all those PCAs that have had to do things and be there for me when I deal with some of this stuff, because some of it's not pretty. And do not make this a broad sweep of the brush. This needs to be very individualized. If you have a drug addict or you're seeing signs, if a doctor's not seeing signs, then there are no signs or the doctor's not doing their job. And the doctor can't control what a person does, but you know, if this is such the problem that it is, it needs to be dealt with on a very individual basis. And not just say, okay, we're going to do this to everybody. And I say this